12th Street is a completely student-run clinic. Primarily, they serve individuals that don't have health insurance, and it's after hours, so maybe people that can't get to clinics during work time.
We were asked to volunteer at 12th Street Clinic as part of our clinical practicum to get experience working in a clinic setting.
As dietetic interns at 12th Street, we worked on a team of interdisciplinary students. On those teams, we'd go talk to the patients, and when we would ask them questions, we as interns could ask them nutrition-related questions and identify nutrition-related problems.
So I didn't feel like I was only learning how to take care of a patient from nutritionally. I felt like I was learning a lot about other disciplines, and I really liked that.
Allowed us to expand our horizons and discover our scope of practice as dietetic interns, future dietitians.
The whole team goes into the patient room together and assesses what's going on with the patient. It's really nice to get to be able to just ask maybe the pharmacist a question right then and there in the room. If I don't know something about pharmacy, we're all students and we're all learning. It's a great way to get hands-on experience, but also learn a lot about other healthcare professions.
The other thing that I liked about 12th Street Clinic was that in addition to working with the other professionals of the interdisciplinary team, it really challenged me to take initiative and take control of my own nutrition assessment on my own, because usually in the past, prior to that, there's always a preceptor or mentor around to kind of coach me or to maybe step in if I was forgetting something. So it really challenged me to be on point and to think of everything that I needed to in order to talk to the patient. But
we would go see our patients, but then we would take back what we learned to a table of preceptors. There were preceptors from every discipline that was there, and they were like our mentors. We presented our patient's case, we explained our thoughts on it, and then they would give us feedback and give some suggestions.
A group of pharmacy students came up with the idea to create a diabetic food pantry. As the dietetic interns, we all got together and came up with a system of coding food by color. We color-coded food red, yellow, and green to sort of teach patients which foods were more appropriate for a diabetic diet. Working at 12th Street really enhanced my education experience because the experiences that I gained at 12th Street directly translate into my current career. Having been able to interact with other disciplines, pharmacists, nurses, medical students, I feel much more comfortable in my career now approaching those members of the healthcare team.
so one really excellent thing that we've made clear about 12th Street Clinic is that it provides healthcare to a patient population that otherwise may not have healthcare. And it's really great that dietetic students get to be involved in giving healthcare to this patient population, because it really rounds out the care to make sure that they're getting the nutrition care in addition to the traditional medical care.
And we've established that this is a great experience for dietetic interns, but what we ultimately believe is that this translates into better quality care for our patients. We want to give them the best